Congratulations on the birth of your baby and on breastfeeding. Why is breastfeeding so important? For many reasons. Your milk is a food for your baby, but it's much more. It contains ingredients key to health and growth that your baby can't get anywhere else. Your milk has live cells that engulf germs to prevent illness. It has growth factors that help your baby's digestive system mature. It has components that help activate your baby's immune system. We are only now starting to understand the many roles your milk plays in your baby's lifelong health and development. Breastfeeding is also important to your health. According to the U.S. Surgeon General, several studies have found the risk of breast and ovarian cancers are higher for women who have never breastfed. The less you breastfeed, the higher your risk of type 2 diabetes, heart disease, and other health problems. The more you breastfeed, the less likely you are to suffer from these and many other illnesses. These health effects are some of the reasons the World Health Organization and the American Academy of Pediatrics recommend exclusive breastfeeding for the first 6 months. After 6 months, they recommend continued breastfeeding along with solid foods for a minimum of 1 to 2 years. But there is more. Breastfeeding also helps deepen your relationship with your baby. It calms and comforts your baby, and it brings you closer. Breastfeeding is important to you and your baby, and Ameda is here to help with products, tools, information, and support. We are dedicated to helping you meet your breastfeeding goals. We know how much breastfeeding matters. The Purely Yours breast pump is ideal for mothers who work full-time or those who just want a fast and easy pumping experience. The portable Purely Yours breast pump and its accessories fit neatly into a stylish tote bag. The tote bag you receive may look different from those you see here. Any of the available bags will safely hold your Purely Yours system. A Purely Yours model is also available without a tote bag. The discreet and organized system is designed for today's busy mother. The breast pump is lightweight and compact. It weighs only 1 pound, yet offers 8 suction levels and 4 cycle speeds. These dual controls allow you to customize your pump settings to your own body's response. Along with the breast pump, the system includes 6 collection bottles with locking caps and 3 freezer packs that fit neatly into a removable, insulated cooling tote. The breast pump can be powered in 3 ways. An AC adapter is included so you can plug it into an electrical outlet. AC adapters for other countries are also available. The pump can also be powered with 6 standard AA batteries. An optional car adapter is available separately. Each Purely Yours breast pump comes complete with a dual hygienic kit milk collection system. This is the world's only breast pump kit with a proven protective barrier that keeps the breast pump and tubing dry while pumping. Mold and bacteria can easily grow in pump tubing when moisture becomes trapped inside it. With proven airlock protection, the solid diaphragm keeps the air from your pump from coming in contact with your milk while pumping. Even if the milk container is turned on its side or upside down, moisture and milk aerosols will not enter the tubing or the pump. With this solid barrier, you don't have to dry or clean the narrow tubing. Ameda's exclusive proven airlock protection helps prevent contamination and simplifies pump care. If your hygienic kit is marked sterile, you may use it right out of the package. If your hygienic kit is not sterile, before using it for the first time, boil those parts of the system that come in contact with your milk for 20 minutes to sanitize them. This includes all parts of the collection kit except adapter cap, tubing, and tubing adapter. After boiling, let these parts air dry. Before pumping, always wash your hands well with soap and water. To assemble the hygienic kit, first insert the diaphragm into the upper chamber of the breast flange. Then, snap the adapter cap, with the tubing attached, onto the top of the upper chamber. Next, hold the white valve carefully by the thick sides, not the flat edge. The valve will compress slightly. Gently push the white valve firmly onto the ring on the underside of the breast flange. The white valve is vital for proper suction and should always be handled very gently. Next, screw the collection bottle into place. And finally, push the tubing adapter, with tubing attached, into the tubing adapter port on the pump. The tubes from both collection kits should be plugged into the tubing adapter. If you single pump and want extra suction, simply remove one tube and close it with the tab on the tubing adapter. When your hygienic kit is assembled, you're ready to use your Purely Yours breast pump. Start the pump with the suction dial before or after putting the flanges to your breast. Turn the dial clockwise to increase the suction and adjust the suction to the highest level comfortable for you. Next, set the pump speed with the speed dial. Again, turn the dial clockwise to increase the speed. Some mothers find their milk flows faster if they first set their pump speed too high. When you hold the flanges to your breasts, make sure your nipples are centered in the nipple tunnel. Hold them firmly, but gently, to create an airtight seal around your breasts. Flange fit is important for comfort and milk flow. What determines breast flange size and your fit is the width of the flange opening. With a good flange fit, you should see space around your nipple as it moves freely in the tunnel during pumping. If the breast flange is too small, your nipple may rub along the tunnel's sides or move very little. If the flange is too large, too much of the breast may be drawn in, and it may be hard to get a good air seal. For a better fit, Ameda's custom fit flange system offers 7 different breast flange sizes, which adapt to all Ameda breast pumps and kits. If your pump or kit includes more than one flange size, try each one to see which is most comfortable and produces the best milk flow. Flange fit can change over time, so check your flange fit every few weeks. If you have small nipples and the flanges included with your pump kit are too large, a reducing insert or flexi shield may improve your comfort and milk flow. If the breast flanges included are too small, larger sizes are available. These larger sizes, called custom fit flanges, can be purchased separately. When your milk begins to flow, this is known as a letdown or milk release. This natural reflex pushes the milk out of the breast and is the most important part of successful pumping. During each breastfeeding, most mothers have 3 or 4 milk releases, even if they don't feel them. When your milk flows faster, you can use your pump controls to follow your flow. To do this, use the speed dial to find the setting that produces the fastest milk flow. Your best speed setting may vary from one pumping session to the next. When your milk release ends and your milk flow slows, try turning the speed dial clockwise again. A faster speed may trigger the next milk release faster. Many mothers pump more milk in less time by using a faster speed to trigger milk flow and a slower speed to drain it. Repeating these fast then slow speed settings several times is what we call multi-phase pumping, which mimics a baby's nursing pattern at the breast. But these suggestions are just a starting point. Always use the pump settings that work best for you. Ameda's custom control was designed with you in mind. To trigger a milk release, it may also help to gently massage your breasts or apply a warm compress. As you pump, tilt the collection kit down slightly so your milk flows into the bottle. Close your eyes, relax, and imagine your baby nursing at your breast. Dual pumping takes much less time than single pumping. When dual pumping, allow 10 to 15 minutes per session. If you single pump, switch breasts about every 5 to 7 minutes and allow about 20 to 30 minutes total per session. When you finish pumping, turn off the breast pump. Then remove the flanges from your breasts. If necessary, break the suction by inserting a finger between the flange and your breast. When the suction is broken, remove the flange. Finally, unscrew the bottles and screw the locking caps into place. Follow the milk storage guidelines you're given. After each use, clean the breast pump and kit. To clean the pump, simply wipe the casing with a soft, damp cloth. All parts of the hygienic kit that come in contact with your milk should be rinsed in cool water and then washed well in warm, soapy water. The tubing, adapter cap, and tubing adapter will not usually need to be washed because the silicone diaphragm prevents them from coming into contact with your milk. The bottles, flanges, and any inserts may be washed by hand or on the top rack of a dishwasher. The silicone diaphragms and white valves should be washed only by hand in warm, soapy water and rinsed well. Be especially careful with the white valve. The white valve should always be washed and rinsed gently and should never be scrubbed with brushes or anything abrasive. After rinsing, all parts should be air-dried.